Coccidiosis is one of the most common diseases that can affect calves, but it is often very underestimated because by the time we see the clinical signs, the damage to the gut has already happened. I'm Holly, a vet turned dairy farmer, and I've worked with calves for years in practice and managing young stock on farm, and coccidiosis is something that I have seen across a wide range of systems. Coccidiosis is caused by protozoal parasites called Eimeria. The main disease-causing species in calves are Eimeria bovis and Eimeria zoonoei. They invade and damage the lining of the intestine, reducing nutrient absorption and leading to diarrhea. It most commonly affects calves from around 3 weeks of age all the way up to 5 to 6 months, right through that key growth period. Coccidiosis spreads via oocysts, pus, and dung. These need time to become infective, so risk builds where contamination accumulates. Calves ingest them from bedding, feed, water, or pasture, and signs typically appear 2 to 3 weeks later. Indoors, risk is driven by hygiene and buildup of contamination, such as used bedding, dirty troughs, and high stocking density. Outdoors, risk centres on repeated use of ground and hotspots like gateways, muddy areas, and around feeders and water. Clean-looking ground does not always mean low risk. Overall, risk comes down to exposure and stress. High exposure occurs with high stocking density, mixed ages, reused bedding or grazing, and poor drainage. And stress increases susceptibility, especially around transport, weaning, grouping, and weather changes. Clinical signs include diarrhea, sometimes with blood, straining, dehydration, reduced appetite, weight loss, and in severe cases, rectal prolapse can occur. One of the biggest issues is what you don't see. Many calves won't show obvious signs, but may still have reduced growth, poorer feed efficiency, and reduced performance. Fecal sampling can help confirm the presence of coccidia and give an indication of oocyst counts and clinical significance, helping you understand the level of challenge in the group. Regular weighing is also really useful. It will pick up reduced growth and underperformance before clinical signs are obvious. It's really important these investigations are started early, as soon as you have concerns, and that you work with your vet. Used together, these give you a clearer picture of what is going on and help guide a targeted plan. Control starts with good management because you are trying to reduce contamination and limit exposure. Indoors, that means fresh, clean bedding and regular mucking out, clean feed and water troughs, kept clear of dung, keeping feeding and lying areas as separate and clean as possible, avoiding overcrowding to reduce contamination pressure. Outdoors, it is about avoiding build-up on repeatedly used ground, moving feeders and water points where possible, using fresh pasture or rotational grazing, managing muddy or high traffic areas like gateways. If coccidiosis is something that's affecting your calves on farm, it's really important to meet with your vet to create a prevention strategy. Alongside good management, you may well find products such as dicoxan can be an effective tool in that management strategy plan. So dicoxan effectively reduces the fecal oocyst excretion and also prevents gut damage by interrupting the coccidia life cycle in the gut. The key things to remember are work alongside your vet, identify what your problems are, and create a strategy that's tailored to your farm using the right product at the right time for the right group of animals.